So, this is Jacqueline, and today I'm going to do the venipuncture technique. So this is my first recording film, so please be patient, and it might not be that smooth. So, for venipunctures, you can bring your handy dandy skill assessment list if you need to, or your lab book. You need your doctor's order, so you need to make sure the right patient and the right date, the right type of blood work to make sure that you're not poking somebody for no reason or for the wrong reason. And then you have your blood labels. So my labels are wonderful. They're printed for me. So it's already identified my patient and it's given me the date of printing. So all I have to add at the end is my initials and the time. And it's also very handy, these ones, because they tell me which tube I need. So my PT, my INR, I need a blue tube. So blue tubes are filled with sodium citrate, and they're very special for many reasons. You need to do a waste before. So you have the choice of doing 2 blue tubes. So you fill up one, you discard it, and then you keep one. Or you can take one vacutainer that has no additives in it. So you would fill this one up, then discard it, and then you would fill up the one that you want to keep. Now to fill these up though, you actually need to fill them up all the way to the line. It's the only one that's very specific on this. If you don't fill it up all the way to the line, the blood will be too diluted. It'll falsify results. So the labs, if they say it's not full, they actually just toss it and they don't even try. And because it's like that, I usually bring 2 just in case one doesn't fill up all the way. Sliding. I need my vacutainer holder, my gauze. Some people use the cotton balls, but according to the literature, it's more a gauze. The reason why I don't like cotton balls is because 1, it's not sterile, and 2, when you actually pull it off, there's these cotton threads that get left behind, so for me it's risk of infection. You need your alcohol swabs. So, they're upside down. So the alcohol swabs, you actually need them to be filled with 70% in order to be a disinfectant. You can use chlorhexidine swabs, but the reason for that is because the chlorhexidine swabs actually have 70% alcohol in them as well as the chlorhexidine. I need my tourniquet. You can also use a blood pressure cuff, a manual one, because you need to control how much you put in. You need your tape. There we go, my hyperallergenic tape. I need my biohazard bag to send to the lab, my piquet to put underneath my patient. You can also do a towel, my hand sanitizer, my Biox, I call it Biox, but it's to clean my workstation, and my biohazard bin. And then I'd be ready to go. Now, the amount of time that it actually needs to be cleaned is dependent on the product you use. This one says, directions of use, it has to be wet. The surface, ensure surface remains wet for 1 minute. So that doesn't mean I have to wipe for 1 minute, but it just means that it has to be wet. So it does take a little bit. That's good. And so now I'm ready for patient care. Get this started. So I'm at my patient's bedside. So the very first thing I do before I get patient contact, of course, is wash my hands. This very long procedure. And usually I do a 2-in-1 and I'll talk to my patient at the same time. It's a good time to do your patient teaching. So, hello, Mr. Nonobi. And then he would be very, very polite and respond, hello. My name is Jacqueline Auger. I'm your nurse today. And the physician has prescribed a PTT for you. Do you know what that is? Yes, I do. It's for my Coumadin. You are correct. I'm just going to verify that you are in fact who I think you are. So, your name, please? And he would respond, George Denobi. Excellent. Can you tell me your birth date, please? Yes, it is January 1st, 1967. You are completely correct. I have the right guy. We're good to go. And then he would laugh. Ha ha ha, you're so funny. All right. So then I would prepare my materials. Well, what I can do before as well is I can actually check, I'm just moving this away from the camera. I can actually check for some veins. So I'll pop this bugger under his arm. So I'm applying my tourniquet. Usually I don't have to hold down a patient's arm, but my lovely little mannequin is not that heavy. My tourniquet. And then this would help dilate my veins so I can start taking a peek at them. And then I would look and hum and haw and find two good spots. It's usually what I do just in case, because sometimes they disappear on you the next time you put on a tourniquet. And so you want to make sure that you want to try for the straight veins. Those are the nicest, but sometimes you can straighten them out by moving the skin around and all that kind of lovely stuff. I feel like I'm forgetting something. Oh yes, so when you do a venipuncture, it's the same thing with an IV actually. You want to work from the distal, so you want to start from the fingertips and work your way up. Because if you actually poke and you miss higher up, or the vein blows or whatever, you can't actually use anything lower than the vein. So then that veins. You have to completely change. And sometimes you don't have that many options on some patients. So work down, go your way up. Now a tourniquet can only be kept on for 1 minute. Otherwise you're going to cause some damage to the blood cells and you'll falsify some results slightly. Oh, my pad is leaking. And I do have this little extra pad beside me because as you can see, he doesn't have veins. So I'm using my low fidelity simulations and they've been poked before, so they're kind of leaky. And in between tourniquet tightenings, you have to wait 2 minutes. So while I'm waiting for my 2 minutes, it's usually when I start to get things ready. So I'll get my tape, and I usually hang my tape on my side so it's easily available to me. My pen, my alcohol swabs. Look at that, they worked. Okay, so I'm missing a butterfly. Just hold on. Here we go. I'm just missing something. All right, so for my needle, there's a whole bunch of different ones that exist. So we have a butterfly needle, and they're called butterflies because they have these little wings. They're quite handy, but we're not using that one today. But as you can see, they actually have a tube, and you connect the vacutainer holder to this part. But I'm doing the procedure today with a multi-sample needle instead, and there are different kinds. So you can see there's this one, which is just the needle, and there's no safety to it. By the way, to get rid of them, there's these little notches in the biohazard bin, and you just slip your needle, I don't know if you see that well, you slip your needle in there and you turn and your needle falls in the hole. So there's that one. This one is a really nice one because it actually has a safety mechanism attached to it, which is the one I'm going to use. But there's also this one, which has an adapter to it. There's no needle. So for this one, you actually also need to bring a needle. And typically you go around a 20 gauge, 1 inch. And of course you would connect it aseptically. And there I have that. So, and to apply my gloves, and it's definitely been 2 minutes, or at least it feels that way. I think I got everything ready. And before you poke, you would put your vacutainer in your vacutainer holder. However, you do not engage, you do not push it all the way up. You only do that once you're in the vein. So to do a cleaning, you would start at your intended punction site, and you would do a spiral to outwards, and you go about 5 centimeters out of your puncture site, intended puncture site. You're not supposed to reuse the same alcohol swab twice. So my intended site is about here. I start there and I slowly, smallly make my way out to get to my 15 to 30 seconds. Too much flow. And then I have to let it dry. If you're applying your tourniquet after, like me, it's only because I forgot before, but you have to be careful that you're not retouching this area because you're actually contaminating it. I'm going to bring everything closer, and it is dry. So I'm just lifting my safety because otherwise it's going to be with my needle. So I'm lifting my needle. I have to pull down, but I'm about 2.5 centimeters below my intended puncture site, and I pull down to secure my vein and to straighten it. So I go in my vein, I engage my tube, and you could actually see how it's filling with blood. And notice how I switched hands. I don't need to do that with that one. That's a discard. That's a automatic sensation. So this is my waist. I'm going to put it in my bio bin later, and this is for my PTT. But if you notice before, I switched hands. So I poked with my dominant hand, and then I switched it so that my non-dominant is holding this, so my dominant can do changing of the tubes. And when you're on your last tube, that's when you disengage the tourniquet. You loosen it all up. I have my intended amount. So I'm applying my gauze onto my site, and I'm readying my safety mechanism. And when I pull out, I get my safety mechanism ready. And I apply pressure for 15 to 30 seconds. Now the amount of times that you flip this, you don't shake, you flip, is dependent on the type of tube. So the blue tube is 3 to 6 times, and I do have it at my line, so that makes me very happy. And then after 15 to 30 seconds, I can ask my patient, can you apply pressure? And of course, my lovely mannequin is not very good at applying pressure. And then I would waste my blood into my container. I don't like doing this. I don't like using my fingers, but it doesn't fit in my little thing. And then I would untwist and pop that in there. I could clean my tourniquet. I'm just going to get my Virex. Clean my tourniquet for multi-purpose use. Should probably also change my gloves before I do that. And then after 2 minutes, I can verify the site and go, oh look, it's no longer bleeding. Take my tape, apply it. Now I have my label. So I'm putting the time, which is 12:50, my initials. To put on the label, you don't do it perpendicular, you put it parallel. I usually start with the name here and I work my way down. I have my biohazard bag, and I would put my tubing in here, and then I would send it off to the labs. I would also thank my patient because he was very cooperative and found me funny. And then I would pick up my stuff. I'm just putting gloves on because I'm actually going to clean this with gloves that aren't contaminated. And I'll pick up my stuff too. And I forgot to perform my hand hygiene after.